We're watching a hearing on the Health and Human Services Department of budget request for fiscal year 2026. It features Health Secretary Robert F. Kennedy Jr. Joining me now for analysis of the hearing and the Make America Great Again movement is NTD News contributor Mike Leon. He's also the host of the news commentary podcast called Can We Please Talk? Good to see you again, Mike. Is anything standing out to you about the hearing today so far?
Good to see you, Chris, as always. There's a bunch standing out to me. I think some of the exchanges that you heard first from the Democrat Raul Ruiz talking about some of the studies. I don't know if you recall that story that came out. I think it was about a few weeks ago or a month ago about the citations within this report that was released and that, some of the information was falsified. So some of the back and forth there, obviously, you see the ranking member, Mr. Pallone here, and what he was trying to submit in terms of all of the different times that they have reached out to, RFK and that department and trying to get some answers from the secretary. So I look, there's a lot to take away from this, but Chris, overarching premise here is that, and I had a similar issue when Javier Becerra was in charge of HHS, and it's really about, is somebody qualified to lead the medical science and information that our country disseminates to the public, that has no degree or no discernible skills in that particular field? And I think you're seeing the Democrats line up on their side to kind of hammer home that point, whereas you're seeing Republicans kind of hammer home some of the things that RFK wants to start implementing, which we can get into some of the things that he's cutting from a bureaucracy standpoint and red tape around pre-authorizations, et cetera. So those are some of the things that are kind of standing out high level so far from this hearing.
So yeah, let's get into the pre-authorizations. RFK Jr. and Medicare and Medicaid Administrator Dr. Mehmet Oz announced insurers will cut restrictions on prior authorizations in certain circumstances. How is this decision hitting with the public?
Yeah, so Chris, this is a prescient topic because, my wife is a medical secretary, so she has worked at a bunch of different medical offices, and she was just telling me about this before I came on. So this is going to be her words, not mine. But also my co-host Nick Savari's wife is a pediatric ICU doctor at St. Luke's Hospital out in Pennsylvania. So very, very, a topic that's very near and dear to us. So the way it works right now, my little daughter, for example, who had asthma and has some afflictions with her lungs, if she needs budesonide and it's recommended by her pediatric doctor, right, that we go see here, it has to be pre-authorized by our insurance carrier, whether it be Cigna, United Healthcare, before we can actually get the prescription. But during that time period, my daughter could go through lapses where she does need this because this will help her lungs. It will help expand them. It will help with the breathing part of this, right? And so cutting the red tape on those pre-authorizations, what Dr. Oz and RFK are assessing with all of this is that the medical insurers hold too much power in this country. And that is something, again, forget Luigi Mangione just for a second, just on a high level, that's always been the claim that medical insurers hold too much power. There's too much red tape for people to get the care that they need, specifically when their doctor has already prescribed it for them. You have to see if you qualify or if you're covered for this because the insurer has to give that. So there's an example that people can take that, my wife was just telling me that this is something good, right? This is something good that all Democrats and Republicans should be unified on because it does cut through the red tape and the bureaucratic hurdles that people need to go to get something that could be in some instances life-saving, could be just in some instances, just something to, augment their daily life, right? But they have to wait for the insurance company to whether approve or disapprove before they can actually go get it from the pharmacist, right? So this is an example of that. And this is something that even I'm on board with respect to what the secretary is doing.
Yeah, it does sound like something people can align around. But are we seeing people align around it and some of the other MAGA Make America Healthy Again, initiatives that RFK Jr. has put forward?
Well, and I think that's where the divide lies, Chris. And I'm glad you framed it like that because, and I can just give the example of, my other daughters. I have two, Andrea, my older daughter, who's, there's an atypical and typical daughter because my daughter's on the spectrum, in terms of linking vaccines and autisms, right? And then there's always this question, specifically from people that are more aligned with the MAHA movement about how do we move away from not so much vaccinating children, but trusting on the medical profession to give us care, as opposed to doing things that will make us healthy so we don't need the medical profession to get the care. And I think that's where the divide truly lies between Maha and then people that are more aligned with, hey, you got to follow science. If doctors say that this is this, this is this will help prevent this, right? So how do we bridge that gap, Chris? Well, first, it's similar to what he's being, asked right now on Capitol Hill. It's the transparency part of this. I want to echo something Dr. Peter Marks, who recently resigned on the FDA board there, and he's been making the television rounds. And he said there were some things that he just didn't trust from RFK from a public information dissemination standpoint and a transparency standpoint. You're hearing that right now in the hearings where people are like, we've asked this question. We asked it in April. We've asked it in May. We've asked it in June. We've got no answers yet. If you truly want to be transparent, you need to do more things like this. There needs to be more dissemination of public health information. But then there's also need to be this realization that RFK is not a doctor. He has said this himself. He's not a doctor. We have to put together advisory boards of doctors, scientists that are not compromised, whether it be by pharmaceutical companies or other interests, and are in the interest of the American public, and that's disseminating information that's around life care and healthcare. This episode of Can We Please Talk is presented by our friends over at Fresh Roasted Coffee. Delicious tasting coffee since 2009. They've been our proud sponsor. You see the promo code there. Look at this. They sent me this beautiful kit right here. Listen to that. Listen to that seal coming out, right? What's in it? Environmentally safe, compostable K-Pods. I love the dark Mexican blend. You can go to their website right now, take the quiz. That quiz is going to put you with a flavor profile. Listen to that sound of the coffee that you're going to be matched up with. Go to freshroastedcoffee.com. Click the link right now in our show notes. You can see it right there. Click that link. It's going to take you to the site. When you get to checkout, use our promo code, Can We Please Get 20? All one word, Can We Please Get 20, 20. You're going to get 20% off your first purchase. Head to freshroastedcoffee.com, our official sponsor of the Can We Please Talk podcast.